Thank you for joining us for a presentation on navigating Medicare. Our presenter is Ted Porter, Executive Vice President at Specialists in Health Insurance Services. Before I introduce Ted, a couple of housekeeping items. This is being recorded, so if you do speak out loud, it will be captured. We are scheduled to go for 1 hour. Ted's presentation will take about 45 minutes, leaving room for Q&A. You can type questions into the chat or unmute yourself to ask your question. You also don't need to wait until the Q&A portion of the program to ask a question. You can chime in or enter it into the chat at any time. I want to highlight that Ted is doing this presentation as part of his role on Cancer Support Community's Legacy Advisory Council. This is a great resource available to the cancer support community. It is composed of insurance specialists, estate planning attorneys, financial advisors, and real estate experts. If you would like more information about the council or how to include CSE in your estate plans, please reach out to me. Now to the show. As I mentioned, Ted is Executive Vice President at Specialists in Health. He is an employer benefits specialist and senior planning advisor. His areas of expertise are employer benefits, individual major medical, federal Medicare, 401k and profit sharing plans, life insurance planning, disability income protection, long-term care, tax efficiency planning, and legacy planning. He was born and raised in the Bay Area, and he and his wife have a daughter and 2 grandchildren who live in the Santa Rosa area. We're grateful to have Ted here to share his knowledge on all things Medicare. Ted, you can take it away, and I will share my screen to display your presentation.
Thanks, Andy. Hello, everybody. My pleasure to be with you folks again. I appreciate what the community support group is doing on these educational programs. I've done them over many years. I believe in them. I think, well, knowledge is power. And federal Medicare is I consult with 9 different law firms around the country. And like all of you here, they're very bright, very smart. But when it comes to federal Medicare, it's like, what are we doing with this program? So we have extrapolated information from the Medicare and You handbook. And I really want you to know this up front, that the information we'll give you today is basic. And if any of you have any offline questions, concerns, want to talk privately, I don't charge for consultations. I'm absolutely delighted to speak with each and every one of you privately. You can get my information through Andy and Libby and talk offline specifically. If you don't get your questions answered today, then please feel free to get to me and we can talk about yourself, family member, whatever it might be. And that's how I roll with this, okay? So Andy is going to be my navigator on this, and I'm really more interested in the Q&A than all the information here, quite frankly. But there is very important parts of Medicare that I want to at least bring out and highlight. And this Medicare and You handbook is over 240 pages or maybe more. So I've taken bits and pieces of that along with some other information to kind of give you some outlines on the costs and some of the benefits, how it works. So we're just going to move into this, and Andy will navigate through the pages with me so you guys can kind of follow along. And this, once again, is recorded, and this information you'll be able to get as a reference pages. That's why I like to work from pages here rather than a PowerPoint type presentation. So Andy, let's go to the first page here. What's new and important? Medicare is always, folks, trying to get better in its services. So, you know, they're working on prescription drug savings. They're dealing with telehealth since COVID came about. We have a lot of telehealth services that Medicare deals with and that helps on COVID-19 issues. Andy, you'll turn the page again. Medicare is definitely trying to work with the COVID-19 vaccines, diagnostic testings, all of these different treatments that as we learn more about that particular ailment, you know, they're getting better at figuring it out. So we'll turn the page again. Medicare when you're new to Medicare during the first 12 months, they give you a welcome to Medicare preventative. It's not a full physical, but it is certainly a baseline that if you have pre-existing pre-existing conditions, that you're able to talk with your doctor about it. Medicare recognizes pre-existing conditions, continues to treat on that. When you've been in the program for 12 months, there's still a wellness visit. Once again, these are ongoing attempts by federal Medicare to try to keep up preventively with your health and be proactive in that way. So turning the page down at the very bottom of this, you'll find Medicare covers in Part A and Part B. We'll talk about those specifically. A lot of various and sundry items that you need to have in your medical care, but there are things that they don't cover. So I wanted to list those as well. You know, typical eye exams, prescription drugs, long-term care, that's a big issue. The next page, cosmetic surgery. These are things that Medicare does not have the funding for. Paying for long-term care protection. If you have long-term care, a policy of some type, and you would like a summary update and use my services to look at where your benefits are now, kind of take a look at where you are, feel free to connect with me on long-term care. We'll show you what Medicare does and doesn't do in that. And we'll turn the page. We're getting into now signing up for Medicare. And this is, if you're turning age 65 and you're not working for an employer that has more than 20 employees, then you need to sign up for Medicare A and B to avoid any of the compliance penalties, and they're penalties, and they add up. So we'll talk about when you don't have to sign up for it. But the idea is if you're turning 65, you want to give yourself 90 days before that 65th birthday to get on SSA.gov, Social Security Administration.gov. There's a Medicare tab on that official website, and you sign up for Medicare A and B. On that website, you create your own account. If you're already collecting Social Security benefits before you turn 65, a lot of people do, then when you turn 65, they automatically send you your Medicare A and B card. If you're working for an employer, you're collecting Social Security, you can bring that, or you can send that Medicare card back to Social Security, because if you're working, there's no reason why you need Medicare, because Medicare Part A is the hospital portion. It's premium free, quote unquote. We've paid our taxes over the years, but Medicare Part B has a premium connected to it, and we'll talk about that. So just based upon your individual situation, you'll know whether or not you need to keep that. So Andy, if you'll turn the page here, let's just get into Medicare parts. Part A is the hospitalization. Any inpatient care on federal Medicare is covered through Part A hospitalization. They offer a very limited skilled nursing facility benefit, hospice care, and very limited home health care if it's less expensive to give you services after a hospitalization outside of a skilled nursing facility. Then they can pay for some of these coverages at home, but it normally is a matter of weeks and not a matter of months. Okay. Medicare Part B is the outpatient care.
Linda.
Anything that's billed other than through the hospital is billed through Medicare Part B, and that is the premium-based portion of Medicare. Medicare Part D is the prescription drug portion, and that was initiated back in 2006. Prior to 2006, we had no retail prescription drug coverage under federal Medicare, except through a couple of very expensive supplement plans. What back then was I and J, but you couldn't go to retail and buy prescription drugs through basic Medicare. So that was a big expense that, has evolved over the years when it comes to the Medicare Part D. If you'll turn the page, Andy. Here is Medicare Part C on the right. Now that's Medicare Advantage plans. This is Medicare's version of an HMO. So for example, on the left-hand side, original Medicare, you have your own Medicare A and B. You add a Part D prescription. If you don't add a Part D prescription, then they start to penalize you 1% per every month based upon the national average of a Medicare premium, which in 2024 is $55.50. So 1% of that is 5.5 cents every month, which stays with you for the rest of your life. So you want to be sure that if you're Medicare eligible and you're buying a supplement plan, you're not taking any medications at all, you still want to buy a prescription drug plan to stay in compliance and avoid all of the ongoing penalties. And then you add a supplement or a Medigap plan. On the right-hand side, the Medicare Advantage plan, you literally assign your A and B benefits over to Kaiser or over to United Healthcare. They have A and B now. Most of these Advantage plans offer a Part D coverage within it, and they're capitated by Congress. There's a congressional fiscal policy that all of the Advantage carriers receives every month, whether they see your body or not, a certain amount of money. It's over $400 and something a month. So with that, the Advantage plans can add a Part D, and if there's enough money in their programs, then they can put podiatry or maybe some small dental plan or something. But an Advantage plan means that you're under the direction of a primary care physician, you're under a medical group, you don't have the freedom to move around. If you're used to choosing your own doctors and having the freedom, then a Medigap, the original Medicare left-hand column, allows you to see any Medicare contracted physician or facility anywhere in the country, and you can make your own appointments. You don't need a primary care doctor to allow you to do that. We'll get into the Medigap where it's coming, my dear. Promise you that. Okay, Andy, if you can turn the page here again.
Sure. And if we can pause for a second to allow someone to ask a question, there's a hand raised.
Excuse me.
Is it Ronald, or you go ahead and ask your question?
Okay, it's a pretty straightforward one. I have a Medicare RX plan with United Healthcare, and the premium I was paying was $35 and change last year. And for this year, without letting me know really anything about it, on January, the premium jumped to $80 and change. So it was 110% premium increase. I can't believe that, I called them and asked them if there was a mistake, and they said no. So are you aware of this staggering increase from United Healthcare for RX plans?
Well, not only Ron on the United Healthcare side, but I had SilverScript, and I was paying $18 in 2023. It moved up to $85 as well in 2024. A lot of the carriers make those changes. Now, normally you would get sometime in September or August a preview of what the 2024 plans are going to be and whether or not the premiums are moving up, and that you have every year, which we'll talk about, between October 15th and December 7th is the fall open enrollment period for prescription drugs. You can also sign up for a new Advantage plan, but these are mainly what you see on the TV, prescription drugs. So during that time, what should have happened, if you had the information, you would have gotten on the .gov website put in your medications, and the software algorithm program would show you for 2024 what is the best selection there. They do all that beautifully for us. I help my clients with that. But now you can't make any changes in your prescription drug coverage for this year until you get to October 15th again, and the new plan would be effective January 1. So unfortunately, you missed that open window.
Okay, I just found it hard to believe. They told me the same thing at United Healthcare. I found it hard to believe that you can't, you can't quit a plan, which is what I want to do.
Well, you can, but it's not advisable. You obviously, because if you quit, then now you're going to stack up those penalties each month. And when you get on a new plan in the new year, they're going to tack on that penalty onto your premium, and that stays with you. So you just kind of have to bite the bullet for the rest of the year, unfortunately, and make that change for the new year. But always remember, folks, October 15th to December 7th is that fall open enrollment. And that's where, if you have questions, you can get to me. But getting on that .gov website and getting the new information for the new year, you can make your change and enroll right on that website, and you'll keep the United Healthcare plan as an example until December 31st, and then January 1, you change into the new prescription drug coverage. That's what you got. But I've seen it, Ron. It isn't, in my opinion, ethical, but the prescription drug companies a lot of times will lower their premiums to get people in the program, and then they find the expenses. And we've seen inflationary costs across this country for a lot of different factors, and Medicare and prescription drugs are no different in that way. I'm not justifying it, because I had the same issue. At that time, I knew to make the change during that open enrollment period, because I didn't like what I saw either, believe me.
Thank you very much.
Sure. Okay, so once again, this is just information about the difference between Medicare Part C, where it's their HMO, you have to stay within their medical and their groups and all that. On the other side, you're paying for the freedom of choice, which a lot of people choose to do. All right, Andy, we'll turn the page. This is important here, folks, because if you don't, and I'm repeating myself, if you don't choose a separate Medicare drug plan, even though you're not taking any medications, when you have original Medicare, that's when these penalties begin. And another big issue that I see is foreign travel. If you're going to be traveling outside of our shores, whether it's Mexico or Europe, whatever, then you, in my humble opinion, you do not want to rely upon federal Medicare for foreign emergency travel expenses. Your travel agent, we sell international travel medical for air ambulance, land ambulances, emergency services. It's a big issue. You can buy it for a week, you can buy it for a year, whatever your travel plans are. But be sure, if you're on federal Medicare and you're going to be planning a vacation abroad, that you look at this and don't rely upon Medicare to take care of those expenses, emergencies. Okay, if you'll turn the page. These are some of the dates. The January 1st really comes into play during the open enrollment for prescriptions. You have that open window, the 15th to the 7th. You make your changes, you keep your current coverage, and everything starts January 1. January 1st through March 31st is simply saying, if you're already on an Advantage plan and you want to get back your Medicare A and B benefits and apply for a supplement plan, as an example, then you can only do it during the 1st of January through the 31st of March, which is, we just passed that window. So, and you can get your original Medicare benefits back. You can apply for a Part D plan, but here's the caution I have on that, which is why when you're new to Medicare, you have a guaranteed issue window. No matter, unless you have end stage renal disease or Lou Gehrig's disease, things like this, there are certain qualifications there. But if you're new to Medicare, there's no medical questions in an application that you have to answer. It's guaranteed issue. So if somebody were to move on to an Advantage plan, and within a year, and they have a pre-existing condition, and they find they're not getting the care that they need out of the Advantage plan, in order for them to, they have to now qualify medically for a supplement plan. So you want to be careful if you're thinking about leaving an Advantage plan to get a supplement, is to check with a person like myself ahead of time to pre-qualify you before you jump ship, because supplement plans have the ability to turn you down because you're no longer in that guaranteed issue window. Andy, do we have a question there? Anyone? No, I
Yes,
thought I saw something.
we'll answer with one question in the chat, and then we'll go to Angela, who has her hand raised.
Okay.
The question in the chat says, I am 67, but have signed up for Part A, but delayed Part B and D because I receive health coverage through my wife's employer. I assume that if I want to sign up for BD, I would do that during the October to December window.
No, you do not have to do that because you're under your wife's plan. I was under my wife's plan for years as well before she lost her job in COVID, because her employer had more than 20 employees. And it was less expensive for me to stay on her group plan than it was to own my own Medicare. So if you're on your wife's plan and you choose it's now time to move on to your own Medicare owned plan, then give yourself that 90 days before that date that you've set to terminate from her plan to sign up for Medicare A and B, or just B if you already have A. And there'll be a letter that the employer, your wife's employer, would initiate for you, which is an employer verification form, and it shows you've had credible coverage over the years that you've delayed your Medicare, and then you can move on to federal Medicare B and buy a supplement or Advantage plan without having to wait to open enrollment. So it's a whole different situation. You've had a special exception to enrollment, and we'll talk a little bit more about that. That gives you that flexibility. Okay.
Thank you, Ted.
Angela?
Okay, so I'm confused about the difference between a supplemental and the Advantage. What's the difference between a supplemental plan and then an Advantage plan?
So with a supplemental plan, Angela, you own your own Medicare A and B benefits, hospitalization and outpatient, right? A supplement plan is an umbrella that sits over the top of Medicare A and B and picks up most of the out-of-pocket costs. And with that supplement or gap plan, you can go to any Medicare contracted doctor anywhere in the country. You have freedom to move around. When you have an Advantage plan, then you've assigned your Medicare A and B benefits over to that carrier, whether that's Kaiser or whether that's United Healthcare or Humana, whatever. And now they're going to manage your healthcare. So you're going to buy an Advantage plan from them. They're going to include Part D. They'll cover A and B with some copays, but you can't choose to go to a doctor at Scripps if they're not referring you there. So you might save some premium dollars, but you're under their managed goals and you don't have the freedom to move around. Two totally different Medicare programs. And that's what you want to understand, the difference between the two. So
Yeah, well, I have United Healthcare Advantage, and yeah, I'm restricted to just the doctors that they cover within anyway. So I just didn't know the difference between the two. But
yeah, one you pay a higher premium for typically, because if Medicare Advantage plans, Angela, like I mentioned, they're sent a capitation payment through Congress, And so each carrier, every person that's under that Advantage plan, whether it's United Healthcare or Kaiser, whatever, they're getting money for you every month. So they can offer you the prescription drug coverage. They can lower a premium for you. They can add, a small dental plan or something, but they manage that care, and you have to stay within their network and get authorizations. If you have a Medigap or Medicare supplement plan, that gives you freedom. You pay the supplement premium, you buy a separate Part D plan, but now you own it yourself and you can move around as you choose. Two different, totally different packages under federal Medicare.
Okay. That's almost
Okay.
clear now. Thank you.
Well, you can get with me, Angela. I'm happy to spend more time on that. So these
Thank
are
you.
just dates, folks, that we covered already. And here, once again, the initial, you can turn the page again, Andy. I think we've covered that enough. The initial enrollment period, as I've mentioned, you've got 3 months before your 65th birthday, you've got the month of your 65th birthday, and you've got 3 months after. So that's the initial open enrollment period that is guaranteed issue. So if you have a pre-existing condition, you want to get your Medicare on time for either your retirement from a group plan or you're turning 65, you get into that SSA.gov website, you sign up your Medicare A and B benefits, you get your card back, and then you decide, am I going to do an Advantage plan or am I going to do a supplement gap plan? And then you have that all in order to go to the first of your birthday month or the first of the month that you're terminating from your group insurance. At that time as well, you're picking up your Part D plan as well. So those are the initial dates. If you apply on your birthday month, then they give you the month after. Anytime you delay beyond your birthday month, you're extending the delay of when your Medicare Part A and B go into effect. So it's always better to manage this by doing this work before your retirement date or before your 65th birthday, so everything starts on the first of the month and you don't have these delays. Okay. And under the special enrollment period, Annie, if you just scroll down a little bit there, turn that, yeah, a special enrollment. So and this is just verifying what I've told you already, folks. It just says here, after your initial enrollment period is over, you may have a chance to sign up for Medicare during a special enrollment period. For example, if you didn't sign up for B or A, when you're eligible because you have employer group coverage based upon current employment. Your spouses or family members, if you have a disability, you can sign up for A and B anytime you're still covered under that group plan. So, sir, you didn't have to wait till October 15th or during the 8-month period, which deals with COBRA, COBRA and Medicare is not something you want to be involved with, folks. If you'll scroll down to the next page here, this just shows you that COBRA does not represent employer group coverage. So retirement plans, VA coverage, individual health insurance is not considered an eligible delay for your Medicare A and B benefits. It doesn't give you that special enrollment. So we really want to be sure that if you're working and you want to initiate your Medicare benefits, plan this 90 days in advance of that. Sometimes you lose your job unexpectedly. You can still make this work. And we talk about all those types of situations, because these are real basic areas that you need to know when it comes to when you can sign up. And you can turn the page again on this thing. And here's just more verification. Coverage based on current employment does not include COBRA, VA coverage, retiree coverage, or individual health insurance. So you can delay it. Once again, if you have employer group coverage through a spouse or your own, as long as that company has 20 or more employees. If your wife or yourself is working for a company that has less than 20 employees, then you need to sign up for Medicare A and B to be in compliance. And you can stay with the group insurance, or you can look at what it would cost for a supplement and compare the two based upon how much the employer is paying for your coverage. All right, so we'll move on there. Here is where we get into the part premiums, part A and B premiums. And you just turn the page. I want to get right into the numbers here. Yeah, so these are Medicare set up premium based on income, Part B and Part D surcharges. So Part A, it's just the hospital coverage. You've already paid your taxes. There's no premium for A. Part B, however, has an income-based premium. And this can be very confusing for folks because Medicare is always looking back 2 years. They work with the IRS. They understand what's on your 1040. So what they're looking for is what your modified adjusted gross income is 2 years past. So in 2024, they're looking back to 2022 to determine if you're single filing taxes or your joint filing taxes. For example, in 2024, if you're single and you made less or equal to $103,000 of modified adjusted gross income in 2022, then the base premium for Part B is $174.70. If you are a couple, they just double that. So you're going to be receiving, when you get into Medicare, a Part B and a Part D surcharge, if there is that, and those are federal charges coming from the federal government. And when you buy a supplement or an advantage plan and a Part D, those are individual policies that you own. So there's premium there. So you've got the Part B or Part D surcharges, and then you've got your individual Medicare choices on supplement or advantage plans. And they can be confusing. And we take some time when we're working with our clients to make sure they see these types of numbers. Now, if you scroll down this page, Andy, you'll see that the more money you make, the more income-related surcharges you're being charged, and these are per person per month. If you're collecting a Social Security check, then they take these numbers as a line item right out of your check. If you're not collecting a Social Security check, if you've delayed those, then they bill you on a quarterly basis, and that comes from Centers for Medicare. And then if you do a supplement plan, those premiums, once again, are separate from these federal charges. And if the more you make, I mean, I have a lot of attorneys that make a lot of money even when they retire, and they're paying these higher premiums up to $594 a month times 2 if a husband and wife are involved, and it's joint tax returns. So these is what are trying to keep the Medicare program afloat financially. We've got 12 million baby boomers still every day turning 65 for the next 3, 6, 8 years, whatever that is. So it's a big program they're trying to keep afloat, and these numbers are changing every year. I haven't seen them go down. I've seen them continue to move up based upon trying to fund this very big program that we have nationally. You turn the page, Andy. This is the Part D surcharges. So, once again, the numbers are the same as far as the income, and these Part D related surcharges are in addition, and that comes out of your Social Security check, or they bill you quarterly along with the Part B. So these are numbers, folks, that I think you should know about. I think you should have them budgeted. If you didn't understand this and want more information from me, we can talk about this offline. This is a really good reference in terms of what federal Medicare is charging you to be a part of this program. Okay? Any other questions there, Andy? Nothing? Okay.
Nothing right now.
So let's move on. These Medigap
Actually,
coverages.
one question just came in the chat. What if you have major loss of income that year, current year?
Sheila, that'll catch up with you because they're always looking back 2 years. So if you had a major loss in 2024, that'll be picked up in 2026. Now, a lot of times you can appeal. If you're going to move on to Medicare during a year of loss, then by all means, I would be working with an agent from Social Security Medicare and working with them in terms of the loss, because you can appeal the cost of these things if your situation has dramatically changed. So I would say that that is definitely an issue, that if you're moving on to Medicare in 2024 and you've had a major loss for whatever reason, you can check in with the Social Security Department, get an agent from there as an advocate, and walk through that process of appealing what that cost would be. So people at lower incomes don't pay at all for Part D. Well, Leah, that's a great question. Typically, if you're a Medi like Medi-Cal, Medicaid, Medicare, there will be subsidies for Part B based upon the income level that you're facing. So you can get subsidies for Part B, Part D. You can get subsidies for prescription drug coverage. There are a lot of things that if you qualify, it's means tested. So if you're a Medi-Cal member and you're moving on to Medicare, once again, it's a program between the state and the federal government. And yes, you can receive subsidies to lower the Part B premiums along with the cost of the coverage within the program. That's a great question. Okay, so if you turn the page here, these Medigap plans are standardized throughout the country, A through N. Now, the two plans that I normally work with are the Plan F and the Plan G. And there are a lot of reasons why, but I think that what Medicare did during the COVID year is they changed the rules on availability of Plan F. So what they say is that if you turned 65 before January 1st, 2020, you still have eligibility for Plan F. In Anthem Blue Cross's case, it's called Innovative F. I'm a broker, I represent all these carriers, but they have a nice clean way of showing their products. So once again, if you turn 65 before 2020, you're eligible for F. If you turn 65 on or after January 1st, 2020, F is no longer available for you. Plan G and the other plans are available. G is the one I would work on, folks, because it's the most comprehensive, and I'm eligible for F, but I chose G because when I'll show you the difference, there was enough premium savings to pick up the deductible that G doesn't cover. And I just went in that direction because I still save more money than I'm paying on the deductible. So these are the standardized plans. And if you'll turn the page, here is Innovative F. Now, you can see on the right-hand column that when it comes to hospitalization coverage, when you have an umbrella of Innovative F over the top of Medicare Part A, it picks up that $632 deductible. Now think about it. If you didn't have any supplement, if all you had was bare bones Medicare and you had to go into Stanford Hospital, $1,632 this year buys you 60 days in a California hospital. Now, California hospitals are $6,000 to $12,000 a day, easy. So it's a very good buy. But the problem is if you have to go beyond 60 days or you don't have a break in the spell of illness, they call that, very technical, and you get to the 61st day, and we've had multiple hospitalizations in a year, and they've gone beyond the 60 days, now they're paying $408 a day out of their pocket with bare bones Medicare. If they go beyond 90 days, Now they're paying $816 a day. So this stuff can be very expensive. If we put Innovative F over the top of that, it picks up the deductible, it picks up the 408, it picks up the 816, plus it gives you an additional 365 days of 100% hospitalization. Terrific coverage with Innovative F over Part A. Now down below under skilled nursing, very limited benefit. Medicare is not set up for long-term care. But if you're in the hospital for at least 3 days and you enter into a skilled facility within 30 days of discharge, Medicare says we'll pay the first 20 days in full, none out of your pocket. But the key is that you need skilled daily care Monday through Sunday. It's rehabilitative care. If you get to the 21st day, they pay all but $204 a day. That's what we would pay. But after 100 days, they don't pay anything. And in the 33 years I've been doing this, I've had 2 clients that met the 100 days because they were severe diabetic complication amputees, and they had to change the dressings every day on the legs. And therefore, that was skilled daily care in a facility. But once they reached 100 days, Medicare stopped paying for that care, and it was on their nickel. So Medicare does not provide long-term care assistance in any way or for any meaningful way for the long period. It really helps when you are hospitalized and then you need rehabilitative care in a facility for a period of time. We're 11:45. Let's move on here to the next page. Innovative F on Part B as in boy. You can see it pays for all of the excess charges and these 80-20 relationships. It can get a little dicey if you don't have a supplement plan or an advantage plan over the top, but you can see your column, once again, is a beautiful bunch of zeros. The home health care, folks, is very limited. You know, if they can save money by having you home and send a nurse there 2 or 3 times a week to help you with rehabilitation, they'll do that for a period of weeks. So don't rely upon Medicare for long-term care. If you turn the page, Andy, Innovative F offers routine vision and hearing screening. There's a lot of different little ancillary products. If we'll turn the page again, Plan G, this is the plan, same as F, covers 100% hospitalization in most cases. Skilled nursing, the same kind of benefit. If you turn the page, Andy, the difference here is that it doesn't cover the $240 deductible. Once you pay that out of pocket, then that's a yearly deductible, annual. Then it works pretty much like the Plan F does, and you save premium. And we look at that when you're comparing whether you're eligible between F and G and which makes more sense to you. Well, if you turn the page, once again, this just shows that foreign travel is something that you really need help with. They have a limited benefit, but you don't want to rely upon that if you're traveling offshores. Okay, if we'll turn the page again, this is the Medicare Advantage types. It's their HMO, but there are various types of those. And if you have a United Healthcare Advantage plan, then it's working as a typical Advantage plan to offer A and B protection with copays and out-of-pocket maximums and prescription drugs typically, and whatever else they can fit in there. You turn the page, Medicare Part D, this is the prescription drug. We'll turn again, Andy. This is that open enrollment period, folks, between October 15th and December 7th. You want to be real clear on that date. So you get in there if you want to make changes and don't miss that. You turn the page again, Andy. This is the prescription drug coverage. Let's go to the second page here. I just want to give you, for example, in 2024, stage 1, the Medicare deductible is $545. That is for everybody. But if you're taking generically dispensed medications, the deductible doesn't apply. If you scroll down a little bit, stage 2 is the initial coverage. Medicare and you share in the cost of that coverage up to both of your totals reaching $5,030, which means that behind the scenes, they're paying their portion, you're paying your co-pays, and when your combined expenses reach 5,030, then if you turn the page, you're done with the initial coverage, and then you jump into the coverage gap. And the coverage gap says that once your out-of-pocket expenses, your portion reaches 8,000 out of pocket, then you move into catastrophic coverage, which lowers everything in terms of the cost. I have clients that get into the coverage gap in the first 3 or 4 months of the year because of very expensive medications, and they move into catastrophic coverage by September, and costs go down a lot. So, Medicare is trying to fund this program to where they can lower these out-of-pocket exposures, but it's a lot of money to be able to do that, and they're trying to figure that out. So it's a moving target. And that right there kind of ends the pages that we need to go through. Once again, folks, these pages are available. I'm available. It's a lot of information. It's like drinking water out of a fire hose, but we try to keep it within the 45 minutes to 15 minutes, the hour. And any other questions? We still have over 10 minutes left. We can talk it out. Feel free to ask anything. There's no question that is not important to me anyway.
Ted, can you put your email address in the chat?
Can I?
Yeah.
I don't know how to do that.
Oh, okay. I'll type it in.
Yeah, thank you.
Yeah.
I think if I do that, I'll lose everybody.
Yeah.
A man's got to know his limitations.
I ask a question about the fees that some of us are billed monthly for having a higher income than is allowed with Medicare. I think I heard you say that the premium is billed quarterly, but mine's billed monthly. Can I change that?
Yeah. Are you collecting a Social Security check, Jackie?
Not yet. Soon.
Okay. So you have to get with Social Security, Medicare, and you want to tell them, instead of monthly, I'd like to go into quarterly billing until have you delayed your Social Security benefits?
Yeah,
Yeah.
I'll be applying to kick it in this August when I turn
You got
17.
it.
Yeah.
So if you want to change from monthly to the quarterly before August,
Mhm.
then you can do that by letting Social Security know and filling out the appropriate forms that they will bill you on a quarterly basis. You have that option. Once you initiate your Social Security benefits for August, then they'll start to take that once again monthly, but they'll take it out of your Social Security check. So you'll have your gross amount based upon your 40 quarters and all that stuff, and
Mhm.
whatever increases that they've had in the years that have been the last few years has been some increases. And
Mhm.
then they'll take that money and they'll show you through a form that you'll get that you're receiving this gross amount, but we're line item the Part D and the Part B
They did
out
that.
of and that'll be the net amount.
Thank you. Gotcha.
Sure, absolutely.
Well, answer the question in the chat and then I'll kick it to Ronald for his question.
Leah, I'm not sure how to make this change before I missed that. It cut off.
Oh, I can read the question to you.
Okay.
I'm not sure how to make this change before I turn 65 next year. I'm covered till then by my former employer. Do I apply for Medicare Advantage and the feds, or Kaiser lets my employer know to transfer?
Well, you're not 65 yet. So like everybody else, 3 months before your 65th birthday, Leah, you're going to get with the SSA.gov website. You're going to sign up for Medicare A and B. Once you get your Medicare card, it has your own ID number and the effective dates of your birthday, the first of the month of whatever birthday month it is. Once you have that card is when you'll pick up your Kaiser card, and on the back of that, customer service and you can call that customer service number and ask for the Medicare Advantage, Kaiser Senior Advantage group, and they'll transfer you. And I believe that once you have your Medicare card and your ID number, the Kaiser team can do that for you right over the phone. I think it's a very easy transformation for you to move on to Kaiser Senior Advantage.
Okay, thank you.
Okay, you're welcome. Who else?
Go for it, Ronald.
Okay. I have another question for you regarding
Sure.
my RX Part D. I'm a veteran and I can get drug coverage through the VA, but I thought I heard you in passing earlier. I believe the VA is, I don't know what they call it, like a recognized provider of health, of prescription drugs. So the reason why I got United Healthcare RX coverage as well as the VA is I thought I might need a drug that the VA doesn't cover in their formulary. So I wanted to be backed up, and I thought I could afford, the $35 a month. Now that it's $80 a month, and I never use it, I'm thinking of quitting. But I want to know if it ever happens that I need a drug that's not on the VA formulary, could I sign up again for a Medicare Part D?
Yes. In my experience, VA Part D is what they call credible Medicare coverage.
Right,
That
right.
meets the standard for your Medicare Part D coverage. Now, I would obviously verify all of that with the Veterans Administration that you're talking with. And I would also verify with them on any medications that you are taking to be sure that they're all covered under that program, so you're not blindsided, right? And what I'd have to question, and I can find this out, Ron, I think it's a great question, is whether or not you can have the VA coverage along with United Healthcare, as an example, or Humana Part D, two coverages on Part D at the same time. I don't know the answer to that. I think it's a great question.
Well, I have that now.
Oh, so you have both now.
I have both now, and I do have one
Well, then there it
expensive
is.
drug I'm taking, but the VA is covering it. So I don't like spending $80 a month for something I absolutely don't use. The
Right.
VA charges me $11 for any drug per month.
Okay. Well, I mean, to me, it's double coverage. You're not
Yeah.
happy with United Healthcare. Why keep that in place if you have credible coverage under the Veterans Administration and they're covering the drugs at a lot less probably than what you cover under United Healthcare?
Yeah, that sounds right. And
Yeah,
when
because with Medicare Part D, you've got 5 tier levels, of medications. And if you're taking an exclusive non-preferred brand name drug for a medical condition, and they're only charging you $11 for that, there's no difference between the generic brand specialty drugs, where Medicare is going to charge you a lot more, then you're in great shape. You're in great shape. I like it.
Okay, so I can call them up during the open enrollment period, and I'm very happy with my Plan F Medigap, the supplemental.
Yep.
For parts A and B, but I want to make that so there should be no problem quitting just the Part D with them.
Correct. Yeah, they're totally different. And if you were to if the premium cost of the F plan ever got to a place you weren't comfortable, because they're not writing as much of that anymore, and with a lot of new money going into that plan, because of eligibility of age, those premiums begin to go up. If you wanted to make a change from F to G, you'd want to do that only in your birthday month, because that's a guaranteed issue, birthday rule number 9. And you would take a look at the comprehensiveness of F to G, which we did on that piece. And you would take a look at the premium differences, which we have those, and make an opinion if you wanted to continue with the F, or whether you wanted to downgrade and take on that deductible, which is really the only difference between those two outside of those ancillary vision and hearing screening. Other than that, basic thing is the same once you meet that deductible, and you can save a lot of money, so you just want to do it only your birthday month, because then we don't fill out any medical questionnaires. We fill out an application, put a replacement form on that, and it becomes effective the month after your birthday. So that would be something you only want to do if that comes up in the future during your birthday month, Ron. That's the message.
Actually, that's very, I thought that was another question I had. I wasn't going to ask you now, but that's really very helpful. So,
Yeah.
So, thank you very much. And do you ever give out, I don't know, do you have a phone number as well?
Sure. Yeah, my Andy has my information. And also, folks, on my email, there is a calendar link that I give consultation. It says 15-minute phone consultation. Whatever we need, we'll take the time to do it. Or you can come in the office for a visit. We're nice Walnut Creek folks here. But my work number is 925-934-1376. And my mobile number is 925-639-0709. And I want you to feel free to ring me up. And if it gets any answer, I'm very, very good about getting back. I'm a busy little boy, but I return phone calls and visit with you. It'd be my honor, my pleasure.
Thanks very much.
Thank you, Ted. We are 1 minute past the hour. I want to be respectful of everyone's time, but if any last question and anyone has been sitting on, I just want to thank Ted for your.
Ted, get to me, folks. Piece of cake. I'm happy to answer any questions.
Ted, thank you very much for your time and your expertise. I really appreciate it. And anyone can.
A lot of information, Andy, real quick.
Yeah. So if anybody has any follow-up questions, you can reach out to Ted or me, and I can connect you to Ted.
Absolutely.